be showing you some techniques to do proper tooth brushing in order to effectively and efficiently remove the plaque that form on the teeth. The first thing that you need to do is to check whether or not you're using a soft toothbrush, such as this one. Any harder, such as a medium or even a hard toothbrush, may be too harsh on the enamel and the gums. Especially if you're an aggressive or enthusiastic brusher, you can cause the gums to recede, or you can cause the enamel to become very weak and to be thinned. Next, we apply a small amount of fluoride toothpaste onto the end of the toothbrush. Some patients get confused about how much toothpaste to use, but it is recommended to only use a pea-sized amount, such as this. The fluoride in toothpaste actually help to remineralize early cavities and also to prevent future ones, so it is quite important that when you do go looking for a toothpaste, that it does contain fluoride. Now to the actual brushing. Holding the toothbrush at approximately 45-degree angle to the gum, you want to be doing gentle circle motions at and around the gums. You can do 2 to 3 teeth at the same time and work your way around. Depending on how much plaque buildup you get around the gum line, your dentist or your dental hygienist may advise you to incorporate a flicking motion, where you first dislodge the plaque that occurs around the gum line and then flick it down and away from the gums. So once again, that's around the gum line and then flicking down. And you work your way from the back to the front, and then from the front to the back, just like that. And then you do the inside. Similarly, 45-degree angle to the gum, working your way 2 to 3 teeth at the same time, and flicking if needed. You do all the top teeth, and then all the bottom teeth, outside and inside, and then for the biting surfaces, you use a firm back and forth motion to dislodge any food or any plaque particles. To finish off, what you actually want to do with these lower front teeth, we're more susceptible to getting more build up there, so you want to be holding it onto the gum and just flicking upwards and away. So that's on the gum, flicking upwards and away. I get a lot of patients asking me which is better between a manual toothbrush and an electric toothbrush. And to be honest with you, it really does depend on the person. Whilst some patients may be able to remove all the plaque effectively with a manual toothbrush, some patients do need that extra help, and that's where the electric toothbrush comes in handy. You'll see in a moment, but the rotating and vibrating of the toothbrush means that it's helping you do the brushing, and all you need to do is guide it in the right path. Essentially, you're holding it at about a 45-degree angle to the gum, like this. Turn the toothbrush on, and you would slowly hold it along the gum line as well. Some patients like to hold it for about 2 to 3 seconds per tooth to make sure that they're getting rid of every last bit of plaque on there. The sequence is the same for the top teeth, from the back to the front and the front to the back, and then the inside along with the bottom. For the biting surface of the electric toothbrush, all you do is hold it along there, probably for about 2 to 3 seconds per tooth, and glide it along. You finish with the front one by just holding it in place and flicking up slowly. The additional benefits of the more up-to-date electric toothbrushes currently available are an added pressure sensor, which is good if you're an aggressive or enthusiastic brusher. If you have been advised by your dentist or your dental hygienist that you are brushing too hard, then you should definitely consider one of these electric toothbrushes. The inbuilt pressure sensor actually has a red light which comes on to remind you to ease the pressure on the teeth and the gums. It can sometimes be difficult to know when to change a toothbrush, but the general rule is about every 3 months. Most patients believe that the reason why we change our toothbrush is the actual wear on the toothbrush, such as this one. You can see that the bristles here are actually quite splayed. The actual reason why we do change our toothbrush every 3 months is actually because of the bacteria that gets left behind on the bristles. Every time we pick up our toothbrush and we use it to remove the plaque and we rinse it under the tap water, there's a small amount of bacteria that's still left on the toothbrush. And you do that every day, 2 to 3 times a day. At the end of the 3 months, it's determined that there's too much bacteria on the bristles to be putting it back into your mouth. And that's why we change to a new toothbrush every 3 months. most frequently asked by patients is how often and how long they should brush for. To prevent the plaque from hardening into tartar or calculus, you do really need to brush for at least 2 to 3 times a day. Ideally after every meal, but realistically morning and night. If you're using a manual toothbrush, usually 3 minutes is a good amount of time to effectively and efficiently remove all the plaque. If you're using an electric toothbrush, as it does a lot of the cleaning and the brushing for you, 2 minutes is usually sufficient. Well, I hope you've learned something new from our video today, and if you're interested in learning more about dental health, you can visit us at cdic.com.au. Thank you for watching.